Good evening to all of you. And today's webinar, our speaker is Dr. Professor G.VIjayakumar, and he is the professor and head of the Department of Clinics, Madras University, Chennai. He's a MBSc, PhD, PG, diploma in ECM, and he has specialized in veterinary clinical medicine, internal medicine, ultrasonography, critical care, cardiology, and endoscopic imaging. And Dr. Vijay Kumar did his graduation, post-graduation on Madras Veterinary College. He got a medal for securing the highest marks in his MBSc. And he did his PhD also in clinical medicine in the year 2001. His keen interest for teaching and research encouraging him to complete various research projects. At present, he is working on diagnostic imaging and electrocardiographic unit, designing of infusion pump for oral rehydration solution in ruminants, therapeutic management of companion animals with establishment of small animal in patient ward. He has published more than 149 research papers in national and international journals, along with more than 35 popular articles to his credit. He has authored 5 books. He has guided 5 MBSc, 3 PhD, and 3 PG diploma in veterinary endoscopy students. He is a recipient of 18 prestigious awards and honors for his research and extension activities. Dr. Vijay Kumar has served TANUVAS for more than 20 years. Apart from the various prestigious awards and honors he has received, there are so many achievements to his credit. Okay, we have a long list of his achievement. Okay, throughout his 20 years of career. Today, we all are privileged to have such a multi-dynamic personality available with us to enrich our knowledge and guiding through this webinar. Thank you, Dr. Vijay Kumar. And now, sir, I would like to request our Executive Vice President, Karunanidhi sir, to say a few words. Over to you, sir.
Good evening to everyone. I'll just take only a few seconds or few minutes only. Welcome to all the veterinarians and welcome to our honored speaker, Dr. Vijayakumar sir. Regarding this IV fluid therapy, it was initially initiated or muted by Dr. Vijayakumar sir that, in large animal, the amount of IV fluid what we are giving is very, very low. And the international practices in US, Canada, or in even African countries, even in African countries, the amount of fluid they use or required scientifically is much larger. And India, we are not practicing that because of some practical issues like large volume packing is not available first place. And then second thing is, even if large volume packing is made available, it is very, very time consuming to infuse 3 liter or 5 liter fluid in one animal. So our practitioners don't have that much time to spend 1 hour or 2 hours in one patient and will be able to do 5 liter or 10 liter IV fluid therapy in one animal. So these were the two major constraints. That is lack of product availability or lack of license for large pack. And then an IV set which will deliver the fluid in a very short period of time. So with our company's licensing and all, we have solved both the problems now. We have made available large bore IV set and then large pack of IV fluid, that is 3 liter pack is available in normal saline, RL, and also saline with the dextrose 5%. So I thank Dr. Vijayakumar sir for proposing this kind of therapy in large animal, and we have made it as a reality today. So I request Dr. Vijayakumar to go ahead and explaining the need of large volume IV fluid therapy in large animal. Thank you, sir. Please proceed.
Thank you, sir. So the PowerPoint is visible to all, sir? Am I audible?
Yeah, audible and it is visible also.
Okay, thank you. Thank you very much. So at the outset, I thank my university authorities, the registrar, vice chancellor, and my directors for permitting me to present the guest lecture. And I thank Mr. Dr. Karunanidhi, Executive and Vice President Alembic, Sir Rajkumar Sharma sir, Dr. Santosh Sinde, and the entire team who worked out for I think maybe more than 1.5 years in bringing out this wonderful product. And I extend my thanks for inviting me for the continuing veterinary education. Thank you very much, sir. I congratulate and appreciate all the participants. So in joining this continuing veterinary education webinar. The topic given is fluid therapy in large animals. So this we have been doing it. Many practitioners, our seniors have been doing this in the practice. There are certain constraints. So because of difficulty in time, because he is a busy practitioner, he gets a large number of cases. Hardly he can spend 30 minutes to 40 minutes per case. If he spends more than that, then you may be losing the next case, which may be an emergency case. So taking this into consideration, so these products or the fluid therapy has been designed to overcome this constraint in the field. Okay. So what is the learning objectives in this webinar? So we will see the importance of fluids, how to calculate the fluid requirement, what are the fluid deficits in disease condition, how to administer the fluids. This slide gives a rough indication of how much fluid or the water is required by cattle. There are many things have been given. I will focus on dairy cattle because it is our concern. 15 to 30 gallons per day. So this stresses the importance of water in any living animal. The NRC has given what is the water requirement. It can be calculated with formula. So you can see the dry matter intake, milk yield, sodium intake, and about the environmental temperature also. These are the factors which is going to influence the total requirement of water by the animal. What are the conditions which causes the fluid loss, especially during this season? The heat stress. Then, of course, the other gastrointestinal tract disorders, diarrhea, right side displacement of abomasum, LDA, choke, intestinal obstruction, rumen lactoacidosis, alkalosis, and other systemic conditions like toxemia, septicemia, and coliform mastitis. These are, I have given the important thing which we are encountering in the field conditions. Now we need to know the distribution of water within the body. So why it is important? Because it is important for us to gauge how much fluid is to be pumped into the system. You know, of the total body weight, 60% is water and 40% is others. I'm sorry. And of the 60%, 2/3 is interstitial fluid and 1/3 is extracellular fluid. 15% is interstitial fluid and less than 1% is transcellular fluid, which is your synovial fluid and meningeal fluid, and 5% is the plasma. We are bothered about the plasma because through the plasma, namely the blood, we can interact with the system. To recap, of the 60% water, 1/3 is ECF, and of the ECF, 1/4 is the plasma. In a nutshell, it is 1/12 of the total body water. See, if you know this 1/3, 1/4, and 1/12, this is important to calculate the fluid requirement in the field. Okay, so we have to take into 3 important criteria for calculating the total fluid requirement in animal. What is that? Replacement. That is what is already animal has lost. The second is maintenance, and third is production requirement or what is going to be lost. For example, if there is a diarrhea, that also to be taken into account, and all these to be added, and we need to administer this fluid. Now let us take the clinical signs and the percentage of dehydration. What is given on the left side column is the percentage of dehydration and the right side is the clinical signs. So this helps us to estimate the percentage of dehydration available in the animal based upon the clinical signs. This is available in any standard textbook or in journal. So I will not go deep into it, straightly concentrating on what is available on the field. 8 to 10%, tented skin more than 5 seconds, increased capillary refill time, enophthalmos, and dry mucous membrane. And the worst is 10% and worst is 12 to 15%, where the animal will be in the moribund, imminent death, and the skin test is more than 20 seconds and CRT is more than 8 seconds. So this left side helps us to assess the percentage of dehydration based upon the clinical signs what is available on the right side column. This is a capillary refill time which we have been taught by our teachers, but somewhere we forgot. When the youngsters come, they simply calculate the capillary refill time by seeing the watch. But that is not so. Press the gums, allow the gum to blanch it. The time taken for the blanched gum to regain the original color is the capillary refill time. How to count it? Don't look into the watch. Continue to look into the gums. Press it. Count it as 1001, 1002, 1003. Where the color regains. That is your capillary refill time. The different places have different thumb rules, but this is universal. 1001, 1002 and 1003 is universal. Certain places like Kerala, they count as 1 elephant, 2 elephant, like that. Whatever it is, the scientific basis is important. Now, why we are doing this calculations based upon the clinical science? Why we need to arrive at the dehydration? This is because we will understand fluid deficit in liters is given by the formula percentage dehydration into body weight. Now, we will understand better when we go with an example. Now we will calculate the fluid deficit of a cow, 360 kg body weight with 10% dehydration. So known fact is the body weight and the formula is percentage dehydration. So 10% into body weight is 360. That gives as 36 liters. Now when you substitute this in the fluid chart, so that is why we have understood the basis of it. So total deficit is 36 liters. Now ECF. This is why I asked you to remember the 1/3 and 1/4. So calculating the ECF deficit, 36 by 1/3 is 12 liters. And your plasma deficit is 1/4 of ECF, which comes to 3 liters. So to recap, so this is your total requirement is 36 liters. Immediate requirement is plasma, which is already lost. If you pump in the last thing, then there will be an effective circulating volume. Then the remaining is 9 liters, which you can give for a prolonged period of time, maybe 6 hours. So when you aim at plasma, the animal is able to attain the effective circulating volume. So when you go to the field, please see to that you replace the ECF. When you are going to replace the ECF, there is no need to have a revisit for the second day, especially for the correction of the fluids. The remaining part, either the animal can be given oral or the animal will start taking the fluid. So this is the base. So you please understand or assess yourself whether we have given the fluid correctly. We have given 1 or 2 bottles, making it up that we have given the adequate fluid. So this is what we are discussing is only the replacement. What is last? Now you have to add on the maintenance and the production, which we will be seeing in the subsequent slides. In case of cows, there is also another thumb rule, namely eyeball, skin tint, and mucous membrane. Concentrate on the last 2 rows. So 9 to 10 and 11 to 2% dehydration. This chart helps us to grade the percentage of dehydration in calves. So namely the eyeball status, skin tint test, and mucous membrane, whether it is a tacky or dry. Still further, it is explained by Constable et al. So it is given in gradation of 0, 2, 4, 6, 8. Helps us to calculate the fluid therapy more better when compared to the previous table. So where more importance is given to the eyeball, sunken eyeballs, what you call as eyeball recession in mm. So concentrate on the last 4 because this is going to be important. When it is more than this percentage, we are going to give IV. If it is less than that, even your oral ORS will be able to correct the fluid. Now to recap, I have already told the calculation of fluid requirement is based upon the volume of replacement, volume of maintenance, and volume of production requirement or ongoing loss. We have already understood how to calculate the last fluid. Coming on to the volume of maintenance, you can roughly calculate it as 15 liters per 100 kg animal. So if it is our 300 kg, you can multiply by 3. And coming on to volume of production, So it depends upon the milk yield or whatever is the ongoing loss. So we'll take the thumb rule. For each liter of milk produced, we require 1 to 2 liters of water. Now take the body temperature normal range 101.5 to 102.5. If there is an increase in the body temperature, namely 1 degree, so above the normal range, we require additional of 4.5 to 5 liters of water. So this is, you should understand, over and above the normal requirement. So this one, for example, we take an animal with 103.5 degree Fahrenheit and milk yield of 5 liters. Elevated temperature, for every 1 degree, you have to give allowance of 1 liter. So we have given a 5 liters. And milk production, for every 1 liter, we need 1 to 2 liters. Here I have put as a 1 liter, so 5 liters. So this is over and above the maintenance requirement. So you calculate the what is lost, what is the maintenance, and what is your ongoing loss or production. This becomes the complete fluid therapy requirement. Now coming to the fluid therapy in adults, so mostly it is a dehydration. Very rarely it goes for a shock. Now mature cattle, mostly it is likely to be alkalotic. Very rare cases it goes for acidosis, as in case of rumen lactoacidosis or diarrhea. In many cases, chloride, potassium and calcium gets reduced. So see to that you are taking steps to replace chloride, potassium and hypercalcemia. If you are going to neglect, then there is a loss, the animal is not going to fully recover. Then one of the most important point is rumen lactoacidosis. This is because we give rice, gruels, chapati, or whatever things available, ration shop materials. So this goes for acute rumen lactoacidosis. You know about the pathogenesis of this one. So what is this? This is acidosis which needs a replacement by sodium bicarbonate. So the needed is immediate replacement is sodium bicarbonate along with the fluids. The formula is millimole of bicarbonate required is 0.3 into body weight into bicarbonate deficit. Please note that this is for an adult cattle. The same one, body weight into 0.6 into base deficit. This is for small ruminant. So only change is the 0.3 is replaced by 0.6 in case of small ruminant. Now thumb rule. So now we can estimate the base deficit based by using blood gas analyzer. But blood gas analyzer cost is 15 lakhs. We cannot afford to have 15 lakhs at field condition. So based upon the many assessment in field conditions as well as with blood gas analyzer, we have come to a thumb rule: mild, moderate and severe. So mild acidosis, you know, based upon the clinical signs, animal may be standing, slightly distended, and other clinics like fluid splashing sound and dehydrated. So in severe cases, it goes on recumbency. There is a detailed explanation given in Constable where already field practitioners are able to grade the rumen lactoacidosis based upon the clinical signs. So based upon clinical signs, you grade the condition as mild, moderate and severe. So here we come to the base deficit as -4 to -6, -8 to -12, -14 to -16. So if you have a difficulty in remembering this, now I have simplified this to remember as -5, -10 and -15 in case of mild, moderate and severe. This is very easy for our practitioners at the field condition. You need not have a calculator, just you can easily calculate -5, -10 and -15 is the base deficit. We will solve it by taking an example. Calculate the bicarbonate requirement in a cattle weighing 100 kg with a moderate acidosis. You know moderate acidosis is -10, body weight is 100 and the formula is 0.3 into -10. So this comes to -300 mole. So always minus indicate that we need to supplement. This is the requirement in an animal. The problem for us is we have got 5% ampule and 7.5% as 10 ml or 25 ml ampule. Now the thing is how to get millimole. We have calculated the bicarbonate requirement in millimole. Now this is available as a gram because 5 gram in 100 ml or 7.5 gram in 100 ml. That becomes the percentage. So now how to calculate this? For that again there is a thumb rule. Each ml of 7.5% will give you 0.89 millimole. Each ml of 5% sodium bicarbonate will give you 0.6 millimole of bicarbonate. Still, if you have a difficulty, I will give you a still shorter version. You consider 7.5%, each ml is equal to 1 millimole for practical condition only and under field. If some youngsters freshly graduate has come, then you have to tell him as 0.89. That is a science. But in field condition, so you can roughly tell it as each ml of 7.5% will give you 1 millimole. How about 5%? 5% we consider as each ml of 5% will give us 0.5 millimole. So under the field condition. But when scientific person comes like a young graduate, please tell him the actual science. We'll solve this by taking an example. Each ml of 7.5% will give you 0.89 millimole of bicarbonate. So for our case, 300 millimole, we need how much? So this is 337. That is 337 ml of 7.5% sodium bicarbonate will provide the 300 millimole in a 100 kg body weight cattle. I hope you understood. Then we will take a next example of 5%, which will give you 0.6 millimole bicarbonate. So by calculating by the formula, we require roughly 500 ml of 5% sodium bicarbonate to compensate 300 millimole of bicarbonate. And again, thumb rule is 1 ml can be 0.5 millimole of 5%. So this is for calculating at field level. Okay, don't make it as a scientific. So field condition alone. So to recap, 7.5%, 1 millimole, 5%, 0.5 millimole. Okay, we will calculate and taking it a small ruminant, because small ruminant the formula varies. Calculate bicarbonate needed for a goat weighing 10 kg, moderate acidosis. Moderate acidosis is minus 10. So bicarbonate requirement is body weight, and specific emphasis has to be given is body weight into 0.6 into base deficit. So it is 10 into 0.6 minus 10. It is requirement is minus 60 millimole. So minus indicate we need to give. So 60 millimole. Now bicarbonate requirement is 60 mole. We have got 7.5% and 5%. Based upon the previous case, we substitute and we understand. If it is 7.5%, 67.4 ml. If it is 5%, we require 100 ml of the solution for a 10 kg body weight goat. Now, there are people who say that I can treat rumen lactoacidosis by giving ringus lactate. Let us see whether it is scientifically true or not. For a 10 kg body weight, so we have seen the previous case. Now, 500 ml of ringus lactate, we can supply only 25 millimole of bicarbonate. So to reiterate in ml, 1 ml will give you only 0.05 ml millimole of bicarbonate. So for this goat, which is weighing only 10 kg, we require 1.2 liters. So if it is so for a 10 kg, then you can understand for a cow weighing 250 to 450 kg, how much bicarbonate can be compensated by giving ringus lactate. So whatever they say, it is by their clinical experience, but scientifically, if it is a rumen lactoacidosis, it can be treated only by sodium bicarbonate. Okay, so the truth is the rumen lactoacidosis can be compensated by specific drug. It is like sodium bicarbonate. Okay. Now the other situation. Now I will give you two situations. The case taking the same example we have seen. Case A is 100 kg cattle and case B is the 10 kg goat. Now you have to touch your heart and tell, and you need not tell it openly. You touch your heart and tell yourself. Okay. So the 100 kg cattle, when I give the fluid with this sodium bicarbonate, when I am treating rumen lactoacidosis with sodium bicarbonate, the animal is okay. But case B, when I started treating 10 kg goat with a scalp pain, before tapping the scalp pain, the goat dies. You should touch your heart and openly accept for your consciousness. So the case B has died, whereas case A has not died. Hope many people will agree with me. So those who have seen exhaustive cases in the field condition. So why I am stressing by taking a two example is we should reason or rationalize why case B, namely the 10 kg animal died while 100 kg animal did not die. So the thumb rule or the important take home lesson is that sodium bicarbonate administration should not exceed 2 millimole per kg per minute. We will solve this by taking the same example. Case A, 2 millimole into 100 kg is 200 millimole. So 200 millimole, even if you take within a syringe, 50 ml syringe, so you may not be able to exceed 200 ml in case of a cattle. But for example, in case of a goat, which is 2 millimole into 10 kg, which will be 40 millimole. So normally for a sheep and goat, you will be taking a syringe 40 ml or 50 ml syringe, which you will use for uterine lavage with the leukocytin. So this will exceed the 40 millimole per minute or 2 millimole per kg per minute, and the animal dies. The experienced practitioners normally dilute this sodium bicarbonate in normal saline. So if you are going to dilute or taking all precautions that 2 millimole per kg per minute is not exceeded, then goat is safe, because your diagnosis is correct, your administration or choosing the drug sodium bicarbonate is correct, quantity is correct, but rate of infusion is wrong. So the busy practitioners, our seniors are doing it correctly. Please learn from them and don't be an enthusiast to pump in all these things in a single stroke and the animal dies. So the take home lesson is the speed of administration is important, not only for sodium bicarbonate, we will see for some other cases also. Okay, so this is for the adult cattle, and we have shared for the goat also. Normally for a calf, because of calf diarrhea, the scenario is metabolic acidosis, low bicarbonate. You give a mixture of isotonic saline and isotonic bicarbonate, which is 1.3, sorry, 1.3%. Then in case of the calf, there are, as I said, you can assess the deficit by, this is called blood gas analyzer, or by means of D-Manor score. So this is very important. So again, the blood gas analyzer is not available in the field condition. So people can take this D-Manor score, which is available in the form of the table, where the 2 points has to be taken. One, whether the animal is standing or not, or whether it is become a recommend. Number 2, is it able to suckle or it is become weak to suckle. So based upon that, you have got a base deficit. That base deficit you can substitute in the formula which we have discussed, and then start giving the sodium bicarbonate. And the thumb rule, if you are not very thorough in assessing the sunken eyeballs as well as the suckling reflex, then you can take this as a thumb rule. Okay, if it is a less than 1 week calf, the base deficit you can take it as 12.5, and if it's more than that, you can take as a 17.5. I am telling as average, otherwise you can take the lower value also, 10 and 15. In case of less than 1 week and more than 1 week, we can take as 15 milliequivalent per liter. Again, to consider other solutions which we are giving in the field condition. So what is isotonic? What is the quantity we needed? We'll take an example of calcium also. We have been, why the calcium is given very slowly. 1 ml per kg body weight is the dose as far as this 23% is concerned. The safe dose is 0.07 milliequivalent per kg per minute. That is 6.6 ml per 100 kg per minute. This is again is going to cause cardiac toxicity. So that is why 15 drops per 10 seconds per 100 kg. So already we are experienced with calcium. So this has been taught in class, and you've been doing it. Many cases it has become all right. Please be emphasized on sodium bicarbonate and other drugs also. This you may be knowing many practitioners. Yes, seniors are able to understand what is this case. Yes, this is a case of hyperkalemia, mostly subsequent to even, suppose for example, you are treating for rumen lactoacidosis. You are pumped in sodium bicarbonate. The sodium bicarbonate will drive away the potassium. So going for treatment of rumen lactoacidosis, you may pump in sodium bicarbonate. Acidosis has been corrected, but potassium has been removed. So it goes for hyperkalemia. You get a S-shaped neck. Many people would have seen this case in the field, many cases. And what is the requirement? You have to pump in potassium. This is one such case where you will get reduced potassium or hyperkalemia because of sodium bicarbonate. And many people would have treated ketosis by administering isoflurane. Isoflurane will also cause hyperkalemia. So take into, these are the important points, thumb rules. So treating it for rumen lactoacidosis with sodium bicarbonate. So don't just after treatment, just don't go home. You please educate the farmer. The animal may go for hyperkalemia in the signs continued recumbency or A-shaped neck. In such case where you have to take care of hyperkalemia. Same in case of ketosis. When you are treating with isoflurpiridone, please expect hyperkalemia. So this is available in 10 ml ampule. Again, what we have seen in sodium bicarbonate administration, the cutoff is 0.5 milliequivalent per kg hour. So it should not exceed. So in a field condition, if it is hyperkalemia, we may require 18 to 20 ampules. I'll give you a thumb rule. Don't dilute more than 3 ampules. 3 ampules is 30 ml in 500 ml saline. So 3 ampules, that is 30 ml in 500 ml normal saline, you can give slowly. So the rough requirement will be 18 to 20 ampules. So if we do not have any assessment, for example, if you have a serum concentration, you have got a lab, take the blood and assess the potassium level. We have got 3 columns here. Left side indicates the serum concentration and the middle one gives milliequivalent per 500 ml. How much is required? How much you have to take it and put it in a 500 ml. Then what is the administration? The third column gives the ml per kg per hour. So this is called as Scott's thumb rule. If you have got a lab, if you are able to get the serum potassium concentration, the middle column and the final column, the third column will help you how many milliequivalent you have to put it in a 500 ml bottle and what is the speed rate. If you do not have, then you follow slow rate, as I have said, 3 ampule in 500 ml such. And coming on to different acid-base imbalances, which we will be commonly inquiring in different conditions. RDA, impaction, torsion, vagal digestion. The preferable is metabolic acidosis with reduction of chloride and severe dehydration. How to treat it? Balance electrolyte. Please supplement potassium and chloride. The other condition is intestinal obstruction, cecal volvulus. Again, your metabolic alkalosis, reduction in potassium and chloride, balance electrolyte with potassium and chloride acidifying solutions. If it is a diffuse peritonitis, the scenario is dehydration with mild metabolic alkalosis. A treatment is balance electrolyte in large quantities. Paracrine mastitis, you know, this is a severe dehydration. You can go with the balanced electrolyte or you can go with the HSS, hypertonic saline solution. Okay, 3 ml per kg. So you can give it that, then followed by isotonic solutions. The only thing is your rumen alkalosis where we will be giving oral acetic acid or vinegar. Okay, 2.5%, 1 to 2 liters orally, and see to that you put a stomach tube and administer the vinegar. So only in rumen alkalosis, so you give the acetic acid. Now we have seen how to assess the fluid deficit. We have come to understand the maintenance requirement and what is the ongoing loss or the production requirement. Add on all this and then arrive at the total fluid requirement. So based upon the formula, we can understand how much fluid or in liters can be administered. So aim at plasma, pump in immediately, and then replace the ECF. Then animal comes to a normal with a early number of days. Now, once you know it, there are 2 ways you can administer the things. One is the enteral route, another is the parental route. So enteral route, so if it is animal is recommended and severely dehydrated, then initial part is, I said, you have to go with the plasma, aim at ECF. The remaining part, so you can give with enteral route. So the parental route is more important, especially in case of neonates. Neonates, if it is recommended, so you have to replace the effective circulating volume. So if you want to save the carbs. So in either case, the parental route through intravenous administration is more important. We'll first see the oral route, then we'll go with the parental route. So you need to have a pump, and what you see in the middle is a connector, and this one is the rumen fluid tube, rumen administration set. So you can see you can pump in. The advantage is that you can pump in 20 liters in 2 minutes. Each stroke pumps in about 300 to 350 ml. So just with 20 or 25 strokes, the entire liter goes. So this is a oral rehydration. It is effective in other conditions also, where the animal is not dehydrated, where you are able to give some mixture, for example, in potassium, as I said, in hypokalemia, you can give the salts in those things. We'll see how it can be done. For example, this is a ORS and a standard ORS for a cattle. Sodium chloride, 216 gram. Dextrose, 250 gram. Mix it in 25 liters, and then you can give with the rumen fluid pump. Now, this is ORS in case of a small calves, 30 gram. So, each one is sodium chloride, potassium chloride, calcium propionate, magnesium. So, mix it in 1 liter, administer twice daily. So, this is again a ORS preparation. In case of small animal, you can administer with a small tube. This is ruminant dehydration therapy. So, again, it comes for a cattle. The only point here it is potassium chloride, calcium chloride, and propylene glycol is added. So, especially propylene glycol plays an important role in rehydration therapy. This is important. Correction of impaction. So, in case of impaction, magnesium oxide 500 gram mixed with 5 liters of water administered through the stomach tube brings out very good effect. The animal which has not passed dung for 3 days passes dung within about 6 to 7 hours. The take home lesson or thumb rule is kindly rule out mechanical ileus. So it should be a physiological or parallel ileus, and all of the things are correct. Correct the fluid therapy and other things. If it is that, then you can give magnesium oxide. So don't give it in a mechanical ileus like intestinal obstruction or torsion. So your rectal examination and the other abdominal ultrasound will help you to guide in those things. This is one such case where the animal has not passed dung. It is only a mucus coated. After administering this magnesium oxide, so this has the animal has passed dung. So it's very good effective. Have this type of cases in our area it is more because the fodder, green fodder is not available, and then unaccustomed dry fodder or roughages are given. And then this is very common occurrence in our belt area. So where there is a green fodder, there is less occurrence of ileus is there. In other cases, it is okay. Coming on to our calves, less than 8%, this OR is more important. It plays an important role. More than 8%, IV is important. You cannot, you have to give IV and then make the animal become all right. Once it has become all right, then you can administer oral. So what is an ORS composition? Is sodium chloride, potassium chloride, sodium acetate, and then dextrose in 1 liter, and prepare that, and then you can administer 3 or 4 times. The thumb rule is don't give more than 1 to 2 liters at a time. Okay. So Downer cow syndrome. So you would have heard this is also ORS component. The potassium chloride is an important culprit. Potassium chloride is the contributing factor for recommend cow. If the animal is recommend, and in spite of your calcium administration and other correction fluid, if the animal is continue to be in recumbency, the culprit is potassium chloride. That's why in ORS for Downer cow syndrome, we have included potassium chloride. 44 grams sodium chloride, potassium chloride with along with water, you can administer in orally, or if you can put it in a bolus, you can put in a jaggery, but it is a little bit bitter. So you can administer in a jaggery and then give. So, but thing is, dosage is 180 to 200 gram per day. So in case of, especially in case of recommend cow. So this is more important. That is the contributing factor. Coming on to the IV, we have got 2 types of fluid, crystalloids and colloids. Crystalloid is a common thing which we have been doing it daily, and colloids is because of the high molecular weight. So it is available. High molecular weight helps us to rapidly maintain the circulating volume. So all these are our isotonic solution: normal saline, Ringer's lactate, Ringer's solution, and DNS. Now colloids, the handy one is hydroxyl ethyl starch. So many companies are coming out. It has got a larger molecular weight, and hence it is able to expand the plasma volume and retains the fluid in the circulating volume. And the other form may be bread and albumin. So previously it was available as a dextran and hemacil. If it is available in place, you can also use colloids. Don't forget to give crystalloids after administering colloids. And if it is anemia, again, blood is also a colloid. Less than 12 or 15%, you have to go with blood transfusion, whole blood transfusion. Now, coming on to the intravenous fluid therapy, the quantity of administration. Routine, you can give it at the rate of 10 to 20 ml, and if the animal is not taking fluids and it has been anorectic, so going for a shock, lateral recumbency, you can go to 40 to 50 ml, and in very severe cases, 90 ml. To be very frank, we do not have the fluid set, IV set, to deliver at the rate of 90 ml per kg per hour, because IV set cannot accommodate this much rate. Many people can ask whether I can give 20 to 40 ml per kg per minute. Now you cannot give unless you use a rapid intravenous administration set. With that also, you will not be able to reach that rate. Okay, so you may ask why whether I will go for a pulmonary edema. You cannot do that because the IV set or the catheter available is not available unless you use a pump. Okay, so you may not cause a pulmonary edema. It is very, very safe. Now coming on to the vascular access, why we go for a vascular access, especially the animal requiring 15 liters or 20 liters. So those who are going for a C-section in a very delayed case, or recommend animals and downers, those the practitioner will accept with me. Putting on a vascular access with a Venflon or catheter plays a major, it is a boon for us. So you can use a ear vein or you can go with a jugular vein. This is what I have been describing as a rapid intravenous fluid administration set. What is the beauty in that? We'll follow it. So this is just we are demonstrating one cattle being administered with a rapid intravenous fluid administration set. You can see a 1 liter sachet there being connected. And normally we will be able to administer a 500 ml fluid in 5 to 6 minutes. If you are using a rapid intravenous fluid administration set like this, along with a suitable catheter or a needle, we will finish 500 ml in 60 seconds. In other words, if it is a 1 liter, we will complete it in 1.5 minutes, 90 seconds. So you can understand the limitation of the veterinarian to spend time at the client house at the field level. So is mainly restricted by the time. So if it is a 500 ml, spending 5 minutes, then think of 10 liters if the animal is requiring, how much time he requires. That time constraint is being overcome by rapid intravenous fluid administration set and your massive volume pack. Previously, we did not have a package. So you consider the time you are alone in the field with only one client. So hanging and changing the bottle every 500 ml, it takes a long time. Now we have got 1 liter pack, 3 liters pack. So changing only 3 bottles. It's very easy at the field condition. And effectively you can restrain the animal. See only one lady, old lady in the field in the condition, and you are there. You may not be able to restrain the animal. Think of a cattle or a bull or bullock. So in a severe, you may not be, you need a sufficient energy. Okay. That you cannot restrain for a long period of time. A rapid intravenous fluid administration set and a 1 liter or 3 liter pack, it comes handy for you or rescue for you to administer the fluid. So join it and it will be easy. And those who are going for a rheumatomia or other things where the severe case where your catheter, placement of catheter is important. Now you can understand this buffalo. See, I have put two cases of fluids, RL and DNS. So how much we would have suffered changing the bottles very frequently. Okay, and certain places they cut the bottles and pour it through that, and that is not scientific, isn't it? So connecting a 1 liter or 3 liters is more scientific, and this will give the actual way of administering the fluids. Otherwise, you can think changing 500 ml sachet is very difficult, tough job unless you have some assistance to do in the field condition. So you can understand, you can see this again. To recap, 500 ml it takes 5 to 6 minutes, and rapid intravenous set, IV set, it takes about only 45 to 60 seconds, and if it is a 1 liter, it takes in 1.5 minutes. Now, for those cases where you require maybe in a horse or in case of cattle, more than 10 liters or 15 liters, the Seldinger's technique is nothing but placement of a catheter. We'll see it. What are the requirements for a placement of the catheter? We need a needle. This is a hypodermic needle. And this is your French dilator. This is a hypodermic needle, the normal needle which you have. And this is a French dilator. If necessary, we will be using it. This is our J wire and this is the catheter. Now I am introducing the needle. You can see the flow of blood. Now passing this J wire, that's adapted there. Push the J wire through the needle into the jugular vein. Okay, just by your thumb action, you can easily push. Now we can see the next slide. Now I am removing the case of the J wire, removing the hypodermic needle. J wire is inside the jugular vein. Now J wire is inside the jugular vein. Through the wire, I am placing the catheter. You can see through the wire, placing the catheter. It is very easy to pass to and fro movement. The catheter enters. If you have a difficulty, you can use the dilator. Most of the cases, I have not used a dilator. The hypodermic needle, J wire, then catheter. See, we are putting the catheter by to and fro movement. It goes very easily. Once the catheter is properly placed, see that you remove the J wire. Now I am removing the J wire and you can connect the IV set. Then fluids goes on. So you can put a stay switcher, put a tape also if necessary to put a stay switcher. So this helps us in the field condition. Dear vets, we do not have time, but at the same time, we are supposed to give scientifically calculated fluid to the animal. For the constraint of time, we are not able to deliver the required fluid. So even for a normal case, as in case of an example, it comes to a 3 liters, which is a plasma, and another thing, which is ECF, which is more huge. So it requires time. If you are having the package, namely 1 liter and 3 liter, and if you are going to have a rapid intravenous fluid administration set, it is possible scientifically for every animal, and the animal recovers very rapidly. Now this shows I am administering the set, and next I am going for a stay switcher, and this is ready. It's not only for the cattle, it is also for the horse. So those who are in equine industry will agree with me. So the horse requires 10 to 15 liters, sometimes 20 liters for management of colic. So in this case, I have placed a needle passing the J wire. The next slide shows passing J wire, and then after that, I'll be removing the needle. Here you can see once it is placed, then I will remove this is the sheath of the J wire. Keeping the J wire inside, we will be removing the needle. J wire is inside the jugular vein. Once it is there, we will be passing the catheter. Now you can see this one, we will be passing the catheter. It's very easy. Here it is, the skin is very soft, and then you can see the catheter is passed with the to and fro movement, because horse skin is slightly thinner when compared to the cattle. And then you can remove the J wire. As explained in the case of cattle, you can put a stay switcher here and put a micropore or whatever requirement. So this is there and safely for 5 to 6 days. So needless to say, check the catheter every day for erythema, swelling, and site of infection. Now coming on to the preparations available in the market, we have got many preparations. And then Alembic, which is a normal saline 1 liters and 3 liters. Alembic, it goes with the name. This is saline and S. This is ringus lactate, it is R. And with the combination of dextrose, and this one is Alembic D. And ringus lactate with dextrose, it goes with the name. And you can see these preparations, Alembic and Alembic. And this is a 3 liters and 1 liters are available. I have been fighting very hard in the field for so many years, maybe 20 years. Now, with this available, I feel very happy. I profusely thank the Alembic company for introducing this, and I have found it useful in the field. And so also, dear vets, I think you will also be finding it useful in the field. Thank you very much. Over to the organizers.
Yeah, thank you. Thank you, sir. There are some questions, being raised by the participant. Some of the questions are already. So I want my team to just sort out the questions and raise that. Santosh or Naresh, you can ask.
Okay, sir, I will do that. And before that, sir, I'll compile this question and answer. I would like to call Dr. Sanjay Latkar, sir, to take us for a short product description. So
okay.
till the time I will prepare this question.
Yes, okay. Go ahead. Sanjay.
Okay. Thank you, Dr. Sunil. And it's my privilege to introduce our product. Sir, I will open the PPT. So, as you know, Alembic is the pioneer to introduce various new segments in animal health industry. So, in that line only, we have introduced IV fluid therapy. Large animal require large volume of fluids. So, there is a chart and dehydration level, and there is a skin fold test. Based upon that skin fold test, we can judge the degree of dehydration. That is 4 to 6%. That is mild. In that case, retention of skin fold is absent. And second one is 6 to 8%. That is moderate. It requires 2 to 4 seconds. And third one is 8 to 10%. That is severe degree. So in that case, 6 to 10 seconds are required. And another one is that is a dangerous condition, that is shock condition, that is 10 to 12%. And it requires around 20 to 45 seconds. To overcome all these challenges, there is a pictures that is for pinch skin test, and that is a normal hydrated cow and dehydrated cow. These are the very useful picture to judge the degree of dehydration level in the cow. And as sir already told, there is a fluid requirement. For total fluid requirement is equal to dehydration percent, it is body weight of animal. And according to that formula, we require 36 liter of fluid. Sir have already explained all this slide in the lecture that ACF is required 12 liter and plasma is required 3 liter. That is on immediate basis. So rest fluid we can administer within 12 to 24 hours. So did we are giving the right fluid? This is the big question. To give the answer, we have introduced first time in India, that is 3 liter pack. If you see in the market, there is a no any company which given 3 liter pack. That is Alembic, normal saline, Alembic, that is RL, that is Ringer lactate solution, and Alembic D, with it is DNS. So this Alembic and Alembic is available in 3 liter pack. So this is a Alembic. It is also available 1 liter as well as 3 liter pack. It contains composition, each 100 ml contain sodium chloride 0.9 gram and water for injection. And we are recommending this for diarrhea and dehydration condition. So rehydrate the fluid loss and bring back the normalcy. And the second one is Alembic, complete electrolyte replacement. It contains each 100 ml contain sodium lactate solution, that is 0.32 gram, potassium chloride, that is 0.24 gram, and calcium chloride dehydrate, that is 0.027 gram. So recommendation is dehydration, diarrhea, electrolyte imbalance, muscular weakness, and systematic acidosis. So balanced electrolyte replacement therapy, that is Alembic. And we have also introduced recently Alembic D, that is sodium chloride 0.9% and dextrose with 5% injection, which is available in 3 liter pack. Composition, each 100 ml contains sodium chloride 0.9 gram, dextrose 5.0, and water for injection. Recommendation is dehydration, diarrhea, and hypoglycemia. So this is also an innovative product and which is available in 3 liter. Apart from that, we have noticed there are various problems to administer large volume. to overcome that challenges, we have introduced special IV set. So this set will help you to give fluid with faster rate. So we have compared our normal set which is available for blood transfusion, as well as we have developed our in-house set. It's take around 30 to 80 minutes for complete 3 liter pack. So it's a time saving and which is a need of the hour. So some commercial sets also available, that is readily available blood transfusion set. It takes around 18 to 25 minutes, which is commercially available. That is a blood transfusion set, which are regularly used in human. Same set we can use and it will take around 18 to 25 minutes. So this is our poster presentation, that our theme, large animal require large volume of IV fluid. So with this, we have introduced and we are trying our level best to give the best solution and best alternate in IV fluid therapy. Thank you, Sunil, and over to Dias. Yeah.
Okay, thank you, Dr. Sanjay Latkar. Thank you so much. So I'll put my slides of this question answer session. So I hope my slide is visible. So we have first question from Dr. Ramesh Tiwari, sir. So his question is, can we infuse plasma loss volume of fluid with IV route and rest calculated volume with oral? So as I would ask Dr. G.Vijayakumar, sir.
Yeah, that is a good question. But actually, I'll reframe his question. Is it sufficient to give plasma, and then the remaining thing can be given orally? Yes. But if you are aiming at replacement of ECF, and remaining by oral will be more appropriate. If you are not able to give, still you have find difficulty in economy or do not have time, you can replace plasma, then the remaining can be given orally. But actually, strictly speaking, you have to give up to ECF. Hope I have answered the question.
Thank you, sir. Then second question is from Dr. Shantanu Nath. He is asking, sir, please prescribe the medicines for hypokalemia.
Yeah, hypokalemia, it indicates it's a decrease in the potassium level. Either you can give potassium IV mixed with saline, or you can give potassium. Hello, are you able to hear?
Yes, sir. Yes, sir. You are audible.
Yes, sir. Yes, sir.
Yeah. Or
You
you
are
can
audible,
give you can give potassium chloride, which is available in the market, 180 gram to 200 gram per day. So as I said, in potassium is a double-edged weapon. So give very slowly. Don't exceed 0.5 milliequivalent per kg per hour. So easiest thumb rule in the field condition is give 3 ampule in 500 ml sachet. Okay, and then the quantity required is 18 to 20 ampules. So that is the treatment for hypokalemia.
Thank you, sir. And then we have third question from Dr. Anumay Bhandari. So he is asking that sodium bicarbonate is available at 8.4% in 100 ml preparation under the brand name of Sodanac. So what could be the dose for it?
Yeah. So scientifically we have been explaining, isn't it? 5% is 0.6. 7.5% is 0.89. 8.4 is 1 millimole. Okay. So it gives a 1 millimole. So you can easily substitute in the formula. For the thumb rule only, I have told you take 7.5 as instead of 0.89 millimole as 1 millimole. 8.4, if it is available with you, it's very well and good. You can directly take it as 1 ml gives 1 millimole. That's very easy. Many places it is not available. It is only human preparation, namely 5%, and 7.5% is available. If you have 8.54%, then I think you are in a very good city or good practitioners are there. Please use that.
Then, sir, second question from Dr. Ramesh Tiwari is that, sir, he is asking about fluid therapy in downer cow animals and how we can evaluate prognosis in this case.
Yeah, as far as the downer is concerned, plus you have to remove the musculoskeletal disorders first. If the musculoskeletal disorder is there, and then it goes for a compartmental syndrome, then it is very difficult. treatment of downer curve at the earliest stage will give you the success. Okay, and needless to say, your physical support, frequent turning of the animal, massage is more important. In addition, fluid therapy. If the animal has really not taken, then you can go. Mostly, you know, it occurs after parturition. And the primary will be your calcium deficiency. In many conditions, you will have a phosphorus also. So in spite of giving phosphorus and calcium, you may get downer curve. So where the culprit is potassium. So always have a assessment of calcium, phosphorus, potassium. Certain cases you need to assess magnesium also. If all the three, calcium, phosphorus, potassium, magnesium are correct, and mostly you have a downer is mostly alert downer. I think you are talking about alert downer only. So it is not because of the infection or other things. So if you are able to give fluid therapy, is the same what you have calculated, the same thumb rule you can follow, and you will become all right. So only thing is you have to give phosphorus little bit more. Well, thanks for that question. When we are using, usually the situation does not arise when you are giving fluid by a normal IV set. Now we are giving a fluid by rapid intravenous infusion set. I think Alembic is supplying you. When you are going to give DNS through rapid intravenous administration, if you are going to administer dextrose rapidly, it will cause hypophosphatemia. This is only interaction. Don't get carried away that we are doing wrong. Rapid administration of dextrose, namely DNS, will cause physiologically, it will cause hypophosphatemia. So take home lesson is, remember you have to give phosphorus. Give 30 ml of phosphorus, 30 to 60 ml. It becomes salt. Okay. So if you are not remembering, because I am administering rapid intravenous fluid, so you forget that phosphorus deficiency will be there. It causes physiological hypophosphatemia. Then animal will go for hypophosphorus. Sometimes you'll go for a discolored urine. So if you are taking rapid intravenous fluid administration set, don't forget to take phosphorus with you. Okay. Thank you for that question.
Then next question is, I think it is for us. Where do we get rapid IV fluid set? It is a human catheter or vet? So Dr. Ramesh Tiwari sir, so Alembic will provide this to you. Then we have 6 questions from Dr. Pranav Menon. Sir, how
1 minute, 1 minute, Dr. Sunil, 1 minute. So regarding this rapid IV set, the large bore IV set. So Alembic we are providing that. My suggestion is that if you are going to use only 1 3-liter bottle, only 1 3-liter IV fluid, and whatever is available in the market, blood infusion set. Blood infusion set is delivering 3-liter IV fluid in 20 minutes time, 20 minutes or 22 minutes maximum. When you go for multiple bottles of usage, so for example, 3 bottle, 4 bottle like that, then you will need this large bore IV set, which will deliver in 12 to 13 minutes time. So for every bottle, blood infusion set and our large bore IV set, there is a 10 minutes difference. If it is only 1 bottle, you can go for blood infusion set. If it is multiple bottles, we will provide that large bore IV set, which for example, if you are using 5 bottle of 3-liter, you can save 1 hour time. So based on your number of bottle which you are using, you can decide, sir. But in any case, we are providing that large bore IV set to you. Thank you very much.
Thank you, sir. Then, sir, 6th question we have from Dr. Pranav Menon. He is asking, sir, how do we correct dehydration in patient with pneumonia or any respiratory issues?
Yeah. The correction of dehydration in pneumonia is equally important. Take care that it does not go for a pulmonary edema. The antibiotic is important. And then fluid therapy. In such cases, oral is important. Okay, animal may not be completely anorectic. So oral ORS will be fine. Replace the plasma. Remaining you go with ORS.
Thank you, sir. Then we have question from Dr. Kumar, whether rapid infusion has to be put only towards the heart.
Exactly, correct. Because as you've seen in the pictures, in a video, the catheter has to be always towards down, towards the heart. Okay, the catheter is fairly a long, big. You would have seen, depending upon the catheter use, it may be 2 inches or 4 inches. So it has to go towards heart only. Any delivery through the in a large volume, that has to be go towards the heart only. Even if you see in small animal also, dialysis catheter goes towards heart. Even in case of a horse, or long cath will be towards the heart only. So placement of the catheter is towards heart. That is a good question. So that will be a awareness to others also who are going to use it for the first time. Thank you for that question.
Then, sir, next question is from Dr. Srinivas Yadav. He is asking, can we add antibiotic with colloid or not?
That's a good question. Can you add anything? And antibiotic is a bracket. I will put a drug. Can we add drug to the solution, IV solution? Yes, we can add any drug only to DNS or NS. In crystal oils, you are supposed to add only with NS. Normal saline is permitted. In rare condition, you do not have NS, you can go for dextrose normal saline. And other things, oral, ringer solution, colloids, you are not supposed to add in these things. Permitted to add drug only in normal saline and DNS. Don't add in any other things. It's not accepted, scientifically not accepted because of the interaction. And people may say by their experience, I have added OTC, oxytetracycline with the ringers lactate. Nothing has happened in my 30 years of experience. When bad case comes, then that is the end of the day. Okay, so because of the precipitation, you are not supposed to add any drug with the other drugs except for normal saline and DNS. Don't add and have a embarrassing situation in the field. Even experienced professor, they have added, I have got the video sometime. So what is this yellow color crystallization has come because of adding OTC in the oral. So far I have not got, this is a new thing. I told this is what you have taught me, sir, in the old, in your class in 4th year. And this is because of the precipitation. Discard that sachet and then administer new one. So people may tell my experience. So remove that experience, but follow the science. Please follow the science. Administer the drug only in NS and DNS. Thank you, sir. Thank you.
Then, sir, Dr. Manoj Sharma is asking the contraindication of fluid therapy.
There is no absolute contraindication of fluid therapy. So fluid therapy is a genuine thing because animal is lost. So animal has lost the fluid. So you are going to scientifically, ethically administer the fluid that is to be lost. So contraindication is like maybe you are changing the, for example, in case of acute renal, those conditions does not occur in case of large animal. Okay. So for example, in case of pneumonia, respiratory diseases, so you are not going to administer fluid in heavy volume as you do it in case of downer cow or a dehydrated animal. So you have to follow the signs. So including the rate. Okay. You are not going to do it in case of animal which is having a problem. For example, in anemia. So those things already, we have all the practitioners are already doing these things. In case of anemia, for example, if the PCV less than 15, you are not going to give a heavy massive fluid therapy. Okay, there is no absolute contraindication for fluid therapy. What we are already following, our practitioners are already following in the field. If the blood is already watery, bracket PCV is less than 15, then whatever fluid you are going to give, it is going to be diluted. And then what I am supposed to do in such case? Give ORS solution. Even administering 500 ml, the treatment maybe a thyleria or a blood protozoan disease. Administering and 500 ml of normal saline with what is not going to dilute it. Okay, it is a 300 to 350 kg body weight. So the drug has to be given is OTC. OTC can be mixed in 500 ml normal saline and can be safely administered. Don't think that you are diluting the blood of the animal with 500 ml. Okay, there is no absolute contraindication. What we are already following, don't give it in anemia or severe respiratory embarrassment. Thank you. That is a very good question.
Thank you, sir. Then the next question is from Dr. Shrikant. He wants to know the Downer syndrome IV fluid therapy in detail. So I think you have discussed.
Yeah, we have discussed. Yes.
Then next question is from Dr. Jacob. He's asking that colloid need to be given only once. As they say, it stays in the body for 8 days. So is it true?
Yeah. Colloid is then because it retains the fluid, it keeps inside the circulation. So it has to be, for example, that is I think this question can be combined with the previous question. When you have an anemia, when you do not have blood, so colloid is the rescue. Your etastarch, your plasma, etastarch, dextran or emacil. Etastarch will be the first choice. Hydroxyethyl starch is the first choice. Then you can go with emacil or dextran if it is available in your area. You can give that. If still you have a blood, that will be the prime one. So if you do not have blood, you can go with hydroxyethyl starch. Thanks. I think these two questions can be combined. So again, colloid is a fluid therapy only. When you are not able to meet out, colloid will be the best, because colloid retains the fluid in the circulating, maintain the circulating volume. So because the colloid is able to maintain, then remaining part crystalloid can be given. So, but you have to give the subsequent area. It gives a time. Colloid gives you a buying time. Buying time in the sense, it gives an allowance so that you choose the donor and then check for the blood matching and then go for it. It gives a time. It gives a sparing time. So you can very well use colloid. So colloid is a rescue for these conditions.
Thank you, sir. Then we have second last question from Dr. Pranav Menon. He is asking that even in case of hemodilution due to PPH or HPD, how do we manage the fluid in case of dehydration?
Yeah. PPH, and I don't think it will go that much very bad. You can use colloid. I think all the three questions can be combined. Please use colloid. That is a very good, comes in handy, especially for PPH, especially in case of buffaloes or in RNA toxicity. So you can use hydroxyethyl starch. It is very good, because in the field we do not get so much of blood for cattle or buffalo. Please use hydroxyethyl starch. Then you can combine with crystalloid. So don't give colloids alone. Colloid has to be followed by crystalloids in little quantity.
Then the last question from Dr. Shweta. She's asking that, sir, in some cases we found that animal has impaction and also severe pneumonia. So how to deal with that cases in terms of fluid therapy?
Who is the doctor?
Dr. Shweta.
Yes, I should thank her, because I forgot to tell this. I think all the participants in this are only doctors, I think.
Yes, sir.
Yeah, so doubly check it, because this is this is an important condition which we have been encountering in our area and in many parts of India also. What she is telling is a impaction, or rather it is a ileus. Ileus condition, as I said earlier, ileus because of the deficiency of the fodder or variety of disease also it comes. First, there are two conditions. One is paralytic ileus, what you call as a functional ileus. Another is a mechanical ileus. And all the vets or the listeners know what is a mechanical ileus. It's because of intestinal obstruction, torsion, intussusception, like that. And functional ileus, it is because of either because of electrolyte, or your main parameter is your potassium, prokinetics, your calcium, your potassium, and chloride. These are all prokinetics. If they are deficient also, it will go for ileus. Otherwise, it goes for an impaction. So rule out mechanical ileus. If you are going to rule out mechanical ileus, intestinal tract is very perfect, there is no obstruction, then the beautiful drug, this is the drug we can use: neostigmine, metoclopramide, and the third useful beautiful drugs is azithromycin. Azithromycin is given by Alembic. I have been searching for this drug for so many years. Only in the last 8 years I am able to get this, because erythromycin is a good prokinetic drug. I am not able to get IV, because large animals we need IV or parenteral. So again, this is being supplied by azithromycin. So where you have to use 8.8 milligram per kg, dilute with a normal saline, give as if you are giving a calcium injection slowly. So see that you give at least 2 liters of normal saline, dilute this 8.8 milligram per kg. To your wonder, you will see the cow or cattle passes the dung within 5 to 6 hours. So the quantity of fluid you are given is only 2 liters. And the condition is, you have said, respiratory problem. 2 liters is not going to cause respiratory embarrassment, and it is going to cause motility. Prokinetic drug, beautiful motility is going to produce animal voice dung. We have encountered so many cases. We are very successful in treating cases. I think I should thank the doctors for reminding me to tell about azithromycin. Only request is, if you are going for treatment for this type of cases, take the vial of azithromycin, put in your packet, and then come back. Because all your treatment are being watched by dash and dash. I need not tell the things, because this is a general form. Okay. So they will copy it and they will do it. And in case of mechanical animals, the owner will lose the cattle. And the other part is, this is a One Health concept. So if it is used by a veterinarian, you will use the dosage and for so many days. If it is used by other people, you will use, better. So that will go for a resistance. And as per the One Health concept, then it causes a problem. Azithromycin is the drug of choice for respiratory problem in human. So very good drug, neostigmine, metoclopramide, azithromycin. Azithromycin is the best drug for treating functional areas in case of cattle. We have treated hundreds of cattle and it has given beautiful result. Not able to pass done for 10 days, 7 days, 5 days. Correct the fluid. The step is correct the fluid deficit. Check whether calcium, potassium are normal. Start giving azithromycin. Animal passes dung in 5 to 6 hours. I hope I